The leaves are changing, the cooler weather. It's just a wonderful time of year. But for 1 in 5 adults, this time of year isn't so great. For 1 in 5 adults, autumn brings along with it a form of depression known as seasonal affective disorder. I have seasonal affective disorder, and my hope today is to explain to you just a little bit more about the disorder. My speech will go through the possible causes, effects, and treatments of the disease. I hope that I can show you that it is much more common than you would ever think. First, we will look at the different causes. Although the exact cause is unknown, there are 2 causes that are generally accepted. The first one is that as the daylight hours shorten, there is an increase of melatonin and serotonin, which are neurotransmitters in your brain, that pool up. They create an excess, and whenever there's an excess of serotonin and melatonin and those types of neurotransmitters, depression develops. Dr. Michael Terman from Columbia University strongly agrees with this theory. He believes that it's in direct correlation with the longer nights. And it also, of course, affects your sleep schedules. Like with me, I'm awake whenever most people are asleep. The second accepted cause is light insensitivity. Dr. Norman Rosenthal from Georgetown Medical University believes in this theory. He says that for many, they can go outside and experience natural light and then come inside and be okay. But for seasonal affective disorder patients, it just doesn't work. For seasonal affective patients, they require daylight, or they need more daylight than the average person does to offset the chemicals that are reacting in their brain. So as you can see, there's still a lot of ambiguity about the exact cause for seasonal affective disorder. Now we will move on to effects of the disease. The first thing that you should probably look out for is whenever you start to stop enjoying your hobbies, and if you have a life disruption. And what do I mean by life disruption? I mean, for some people, SAD can make their ability to get to work and to work efficiently or work well nearly impossible. If that occurs, you need to talk with your doctor immediately. Some people compare SAD to hibernation because there is extreme fatigue and overwhelming sleepiness that's involved. Personally, that's very spot on in my opinion. As for some people, they resort to substance abuse and they will choose to self-medicate to help deal with the symptoms that they're experiencing. Also, if some people experience suicidal thoughts or actions, they need to immediately talk with their doctor. As for myself, this speech was a big struggle for me. As I struggled with my SAD, I had difficulty getting all the required materials done for this assignment. Now we will move on to 3 different ways that the disorder is diagnosed. There's 3 common evaluations. The first one is your doctor may have you fill out a survey called the Personal Inventory for Depression and SAD, and then he may have you go through an physical examination so that he can determine if there is anything physically going on that is causing your depression. And finally, there's specific criteria that must be met for SAD to be actually diagnosed. To be diagnosed, patients have to have seasonal affective episodes for 2 concurrent years. There are 3 different treatments that are also available. The first one is phototherapy, also known as light therapy. It is much more common now, as you can get these lamps, special lamps that are made, and you can have them in your home. But for it to be effective, you need to be exposed to this light, which must be 10,000 lux, for at least 30 to 45 minutes. The next recommendation is that you attend counseling. Counseling is always a good resource. And finally, of course, medication. There is medication such as Prozac, Wellbutrin, and Zoloft that have proven to be extremely effective. But ironically, for many people, after the winter months and the seasonal affective months are over, they can be taken off of those depression medications. So, as you can see, seasonal affective disorder is extremely complicated. It is very complex and multifaceted. There are numerous symptoms, numerous theories about why our brains have this problem with the disorder, and it is just extremely complicated. But if you're experiencing seasonal affective disorder, you need to talk with your doctor, talk with your friends, talk with anybody, somebody that can help you. For myself, having a support group has been the best help that I've ever had. Many people experience this. As I said, 1 in 5 adults will experience this. Everybody experiences the winter blues to some degree, but for SAD patients, this is experienced at a higher level, more intense level. Even author of Harry Potter, J.K. Rowling, experienced depression. She described it as the inability to envisage ever being cheerful again. It is a loss of hope. It is very different. Depression is very different. But if you will keep going, you will get to that light at the end of the tunnel.